Good day everyone. I am Luigi Winsley Okiboy from BSN3. Today, I will perform the procedure on starting an intravenous infusion. For the definition of IV therapy, is the giving of liquid substances directly into a vein. It can be intermittent or continuous. Continuous administration is called an intravenous drip. The word intravenous simply means within a vein, but is most commonly used to refer to IV therapy. Purpose: Number 1. Maintain or replace body stores of water, electrolytes, vitamins, protein, fats, and calories in the clients who cannot maintain an adequate intake in mouth. Number 2. Restore acid-base balance. Number 3. Restore volume of blood components. Number 4. Administer safe and effective infusion of medication by using an appropriate vascular access. Number 5. Monitor central venous pressure. Number 6. Provide nutrient while resting the gastrointestinal tract. And lastly, number 7, to establish a lifeline for rapidly needed medication. So, here are the equipments needed for starting an IV infusion. IV fluid, IV tubing, IV cannula, tourniquet, cotton balls, alcohol, scissor, and lastly, the surgical tape. The step-by-step process of this procedure is: first, check the doctor's order and make an IV level. Prevents the contamination of IV solution and hands to prevent the spread of microorganisms. Maintain aseptic technique when opening sterile packages and IV solutions. Prevents the contamination of IV solution unset, which can infect rapidly the client. Clamp tubing, uncap the spike and insert it into the entry site on the bag or bottle as manufacturer directs. If an additive is ordered, incorporate it before inserting the spike into the entry site. Then, suspend the IV solution on the hook in the preparation area and press the drip chamber and allow it fill at least halfway. Then remove the cap at the end of the tubing, release the clamp and allow the fluid to move through the tubing. Allow fluid to flow until air bubbles have disappeared. Then close the clamp and recap the end of the tubing and maintain sterility of the setup. Then notify the physician or nurse who will insert the IV. When he or she arrives, bring preparation to the bedside. Identify the client and explain the procedure. Mayang adlaw ma. Ano sa inyo ma?
Nakatay si Angel.
Edad ma?
I'm 20 years old.
Pwede ma mag-insert tag-IV ka ma.
Okay, sir.
Thank you. Hand the tourniquet to the doctor or nurse, followed by cotton balls with alcohol and the needle or basicon. Observe while the doctor or nurse is inserting. Anticipating the needs of doctor is one good characteristic of nurse. Release the tourniquet when he or she indicates or when a return of flow of blood to a doctor is observed. The tourniquet increases venous pressure resulting in automatic backflow, an indication that a needle is inserted into a vein. Then connect the tubing to the needle. Support the needle with a small piece of gauze or tissue paper under the hub, if necessary, to keep the needle in place. Then loop the tubing near the site of the entry and anchor it with plaster to prevent pulling of the needle. Start the rate of flow of solution promptly by releasing the clamp of the tubing. Blood will clot readily if IV flow is not maintained. Then adjust the rate of flow according to the doctor's order. The physician will prescribe the correct rate of flow. Then complete the label of tape to the IV bag or bottle. Do the aftercare of the equipment and wash your hands. Document the procedure and the client response. Chart the time, site, device use, solution, and rate of flow and physician or nurse who inserted the needle. And lastly is monitor every 30 minutes to check the flow rate and observe infiltration and other untoward symptoms. Next procedure is regulating intravenous flow rate. Accurate infusion rates are essential in delivery of solutions and medications. Appropriate regulation of fluid rates reduces complication, for example, phlebitis, infiltration, fluid overload, or clotting of the VAD. Associated with IV therapy, changes in client position, flexion of the IV site extremity, and occlusion of the IV device infusion rates. Purposes. First is to comply with the prescribed rate ordered by the physician. Second is to maintain an equal and constant rate of fluid administration throughout the duration of the infusion. Third is to assist in reassessing the progress of the fluid infusion. And lastly is to prevent circulatory overload or insufficient correction of hypovolemia. Review the accuracy and completeness of physician's order in client's medical record for client's name and correct solution. Type, volume, additives, rate and duration of IV therapy. Follow the 10 rights of drug administration. Check the patency of the IV line and the needle. Any interference with the patency of the IV line will influence the IV flow rate. Adjust the IV clamp as needed and recount the drops per minute. This regulates the flow rate into a drip chamber, and this provides for observation of the IV infusion and the client's response. Count the drops per minute in the drip chamber while holding the watch beside the drip chamber. Holding the watch next to the drip chamber allows the eyes to focus on the drops and the second hand watch to provide an accurate count. Record rate of infusion in drops per minute or milliliters per hour in nurse's notes or on parenteral administration form according to agency policy. A change of shift or when leaving on break. Report rate of and volume left in infusion to nurse in charge or next nurse assigned to care for client. Next procedure is discontinuing intravenous infusion. When the client no longer needs IV fluids, IV medication, or access for emergency drugs, the cannula is removed. Standard precaution must be followed when removing an IV cannula because there is almost always a slight amount of bleeding that occurs. The step-by-step process of the procedure is first, check the physician's order for discontinuing IVF. The second is wash hands and assemble all equipment to save time and energy. Don gloves and clamp the infusion tubing. Clamping the tubing will prevent the fluid from flowing out of the needle and client or bed. Release anchorage of arm, tubing, and needle. Loosen the tape at the venipuncture site while holding the needle firmly and applying counteraction to the skin. Movement of the needle can injure the vein and cause discomfort to the client. Counteraction prevents pulling the skin that causes discomfort. Hold the swab above the venipuncture site. Withdraw the needle quickly by pulling it out along the line of the vein. pulling out in line with the vein prevents injury of the vein. Immediately apply firm pressure to the site using the swab for 2 to 3 minutes. Pressure helps stop the bleeding and prevents injury of the vein. Check the needle to make sure that it is intact. Report a broken needle or catheter to nurse in charge immediately. If a broken piece can be palpated, apply tourniquet above the insertion site. Apply the dry cotton balls or band-aid to cover IV site. The dressing continues the pressure and skin covers the open area in the skin, preventing infection. Then discard used supplies appropriately, then remove gloves and wash hands. Record the amount of fluid infused on the input and output record sheet and on the chart if necessary. Include the type of solution used, time, and reason for discontinuing infusion, and a client response. This ensures accurate documentation of client response.